Here's a hard mass. You can see just a skull radiograph on the right side. You can see how there's a black area where the tumor is invading the orbit, invading the bone. Cellulitis is also an orbital problem. I guess I see cellulitis more often from lavage systems. You get a subpalpebral lavage system as abscess, or generally don't have to take the lavages out if they're still working. Leave them alone and just treat with not topical and systemic nonsteroidals if they're not already, and ice or heat. And what we found is that we use these hard cups a lot to protect the eyes while they have lavage systems, and the ice packs fit. These little ice wraps fit perfectly in the cups, and so nobody has to stand there and hold the pack against the horse. You just put it in the cups. They work really well. If you were going to use heat, heat can also be heated packs or whatever can also be put inside the lavage. I'm sorry, inside the hard cups. Endophthalmitis, it means that the inside of the eye is infected. It can also cause if you get infection inside the eye, that eye is going to be removed at some point. In general, the horse eye does not tolerate infection inside the eye. This was a horse that was accidentally got a formula injection inside the eye instead of against the ethmoid hematoma, and 1 month later, I mean, I thought it was just have to be enucleated, but it actually ended up being able to save the eye. But this is really some severe orbital cellulitis and endophthalmitis. Orbital fat prolapse occurs, I guess. It can be in post-trauma, can be following enucleation. There is a soft tissue, connective tissue septum that keeps the fat behind the eye. There's normally fat in the orbit, and but sometimes this septum can break down, and if so, it generally becomes an unsightly problem. I try to talk people into leaving it alone, not worrying about it, but some people want to try, and there's one or two papers in the literature talk about removing this, and the worry is you remove the fat and you get more fat come forward because it is really difficult to repair that septal defect. So, but these look like they look like tumors too. Sometimes the owners think that the horse has got cancer and it's just fat underneath the conjunctiva. Orbital foreign bodies. I got this picture of Vin. The vet gave me permission to use it. Just look at this horse. I mean, it's got this almost 10-inch long piece of wood stuck behind in the supraorbital fossa, and it got enucleated because there was eye damage as well. Enucleation, just to discuss it a little bit, it's the main orbital surgery, I suppose. And people, including myself, don't like how the horses look afterwards because you get these pits. But then again, if you're enucleating it, you're usually removing a painful eye, and the horse feels better afterwards. And generally, most often, most of us are removing it due to some sort of a bad corneal ulcer or chronic uveitis, maybe an intraocular tumor or uncontrolled inflammation inside the eye.